locus coeruleus of pons. Raphe nucleus is situated in lower pons and upper medulla. Activation of this nucleus results in non-rapid eye movement sleep. This nucleus secretes serotonin. It is located at the junction of midbrain and pons. It produces rapid eye movement sleep. It releases noradrenaline, which induces rapid eye movement sleep. Inhibition of ascending reticular activation system. Ascending reticular activation center, a system responsible for wakefulness because of its afferent and efferent connection with cerebral cortex. The inhibition of this ascending reticular activation center induces sleep, whereas the lesion leads to coma. Now, the sleep-wake cycles occur in circadian rhythm in 24 hours. Now, different sleep disorders. Insomnia, that is inability to sleep or abnormal wakefulness. It is most common sleep disorder. It occurs due to systemic illness or mental conditions like psychiatric problems, alcoholic addiction, drug addiction. Hypersomnia. It is excess sleep or excess need to sleep. It is occurred due to lesion in the third ventricle, brain tumors, encephalitis, chronic bronchitis, and the disease of muscle. It is also occurring in the endocrinal disorders like myxedema and diabetes insipidus. Then we have narcolepsy and cataplexy. Narcolepsy is the sudden attack of uncontrollable sleep. Cataplexy is sudden outburst of emotion, and they both are due to hypothalamic disorders. Sleep apnea syndrome. Sleep apnea is the temporary stopping of breathing repeatedly during sleep. The apnea is due to decreased stimulation of respiratory centers, arrest diaphragmatic movements, airway obstruction, or combination of all factors. Now, sleep apnea syndrome occurs in obesity, myxedema, enlargement of tonsil, lesion in the brain stem. The common features, they are loud snoring, restless movements, nocturnal insomnia, daytime sleeping, morning headache, and fatigue. In severe conditions, hypertension, right heart failure, and stroke. Then nightmare. Nightmare is a condition during sleep that is characterized by the sense of extreme uneasiness or discomfort or by frightful dreams. It is mostly occurring during rapid eye movement sleep. Night may occur due to improper food intake, digestive disorders, or nervous disorders, and can be seen if there is drug or alcohol withdrawal. Night terror is quite similar to that of nightmare, commonly seen in children, and is occurring shortly after falling asleep during non-rapid eye movement sleep. There is no psychological disturbance that is seen. Now, somnambulism. Somnus is sleep, ambulare is to walk. Now, somnambulism is getting up from bed and walking in state of sleep. The episode is lasting for few minutes to half an hour and is occurring during non-rapid eye movement and in children who are associated with that of psychological disturbance. Nocturnal enuresis. It is involuntary voiding of urine at bed, bedwetting, common in children. Movement disorders during sleep. It occurs immediately after falling asleep. Sleep start or hypertonic jerk is the common movements disorder during sleep. It is characterized by sudden jerks of arms or legs like cloners. Other movements disorders are teeth grinding. Now let's talk about another disease related to that of nervous system. And what is that? That is epilepsy. Now, epilepsy is a brain disorder characterized by convulsive seizures or loss of consciousness or both due to sudden and periodically uncontrolled discharge of impulses from neurons of brain. The types of epilepsy. The modern classification is based upon the nature of seizures rather than the presence or absence of an underlying cause. Epilepsy is divided into two categories, that is generalized and localized epilepsy. Generalized epilepsy is due to excessive discharge of impulses from all parts of the brain. It is subdivided into three types, that is grand mal, petit mal, psychomotor epilepsy. The grand mal is characterized by sudden loss of consciousness and is followed by convulsion. Before convulsion, the person feels some hallucination called epileptic aura. The convulsion occurs in two stages, that is tonic stage and clonic stage. Now the causes of grand mal epilepsy can be strong emotional stimuli, hyperventilation, alkalosis, effects of drugs, very high uncontrolled fever, loud noises, bright light, traumatic lesions in any part of the brain. Then petit mal epilepsy. In this person becomes unconscious suddenly without any warning and is going to last for like 3 minutes to 30 seconds. Only muscles of face twitch and blinking of eyes taking place. Cause can be unknown, exact one is still unknown, but can be due to head injury, stroke, brain tumor, brain infection. Then we have psychomotor epilepsy. It is characterized by emotional outbursts like abnormal rage, sudden anxiety, fear, or discomfort. This confused mental stage for some period. Some persons attack other bodily or rubbing their own face vigorously. The causes can be abnormalities in the temporal lobe, there is tumor in hypothalamus, there is tumor in limbic system. You can see the different ways which are seen in different types of epilepsy. In grand mal you can see, in petit mal, in psychomotor. So by the help of electroencephalogram we can find out that which type of epilepsy that is there. Localized epilepsy is due to excessive discharge of impulses from one part of the brain, and it involves only a localized area of cerebral cortex or the deeper parts of cerebellum which are affected by tumor, abscess, or vascular defects. So that's all about today's lecture. We have learned about electroencephalogram, sleep disorders, epilepsy. So stay blessed, stay tuned. Up till then, Allah Hafiz and all the best.